So we saw large numbers yesterday, right? How's it looking this weekend?
Good afternoon, Shahan, and the viewers, and thanks for having us. Well, the numbers were pretty good. The numbers that we saw yesterday, we had 71,462 in Gauteng from a total of 248,873. So that's about 29%. So we are very happy, we are very pleased. But beyond the numbers, of course, we are much more inclined and interested in people. Where are they? How do we get to reach the most vulnerable, even within that cohort of 18 to 34? So the challenge for us is to make sure that the momentum is maintained, and we'll see as the days go by.
Of course, we know that this is the younger generation, so if they're not taking TikTok videos of them getting their vaccines, they are obviously trying to make it fun. Can you adapt as a department to cater for this so-called new audience you have coming through?
Well, definitely. In fact, remember, this program is actually for the people, and what we actually do is we adjust in order to enhance the participation of the very same people. So in short, yes, we definitely make adjustments, and we also adapt. Part of us are not as young anymore, but we are learning as things go by, and we are quite happy and excited and look forward to the rest of the 18 to 34 joining us as the days go by.
Yeah, Adiel, of course, 18-year-olds are not people who want to fill out lots of paperwork. I know when I went to get my vaccine, you have to fill a form online, then you have to fill a form when you get there, and then there's another form you fill online while you wait. So is there any way that the department can actually re-look at this long process for younger people, or for everyone, actually, who goes to vaccinate?
Yeah. So in principle, of course, it's a requirement that a person has to be on EVDS. And there have been cases where if the systems are offline, people actually resort to manually registering and capturing people, etc. And then, of course, once the systems are back online, people are uploaded online, etc. So the point is, it's a requirement to be on EVDS. And if we increase the data capturers and other processes, we really want to make sure that, of course, the experience is also enjoyable on the part of all those that are participating. So yes, it's something that we are looking at seriously, as well as just ensuring that there is efficiencies along the system. But it's a requirement, Shahan, I must indicate, that people actually appear on EVDS.
No, absolutely. I fully understand that. I'm just talking about the other paperwork when you're standing there, but I'm glad you are going to consider re-looking that. Let's talk about the large numbers. You said over 71,000 people showed up yesterday. Do you have enough vaccination centers to handle the numbers going forward? Are you looking at opening up more?
So currently, as things stand, we actually have 375 sites. But that excludes all our public healthcare facilities and hospitals, which as of yesterday have now been activated to also come in and assist and act as vaccination sites. So all in all, going forward, we are looking at probably somewhere in the region of 600 to 700 sites. And then our job is to adjust depending on the dynamics on the ground. So it's 375 as of yesterday. And as I've indicated, in the next couple of days, we expect 300 and something healthcare facilities and hospitals to also join within that pool.
All right, let's talk about the COVID-19 numbers. I'm seeing that overnight 1,468 cases were recorded in Gauteng. Of course, not as high as in the previous month, but we saw it go into the hundreds, and now it's back up to over 1,400. Is there any concern here, or are we happy with how things are turning out?
Shahan, we really have to indicate that, remember, our target is actually 100,000 per day. And we are not going to back down on that target, because part of what we are trying to ascertain is to make sure that people are vaccinated in the minimum possible time. The concept of herd immunity requires numbers to be done within a specified period of time. So as long as numbers are not at the mark where we think they should be, we'll do everything in our power to enhance and ensure that those numbers are raised.
Adiel, I think you might not have heard my question. I was asking about the COVID-19 numbers, the infections in Gauteng. It's back up to over 1,400. Are you concerned about that?
So the cases is something that I would really hand over to my other colleagues, because I head the vaccination program. As far as the cases are concerned, we do have a dedicated unit that has all the information and all the data and all the details, and I really wouldn't want to steal their thunder.
Oh, okay, cool. That's fine. Absolutely fine. So let's talk about the vaccination program a bit more then. I'll bring it back to your portfolio, so to speak. You said you were aiming for over 100,000 vaccinations a day. Are you actually hoping to get that amount of people coming out, though, every day? Or is it still too low to reach that target?
Well, I mean, if you look at what happened yesterday, we are on 71,000. And remember, this is the first day where we have the 18 to 34 cohort. Now, in Gauteng, just to give you an indication, that cohort is 45% of the population. So if we maintain that momentum, we are very, very confident that we will get to the 100,000 mark. And also, going forward, there are more mass sites that are being opened. And as I've already indicated to you, we are coming on board with all our healthcare facilities, both at primary healthcare as well as at hospital level. So we are quite confident that that target, we will meet it in the notes. So in the next few days, we should be, at least if we don't get 100,000, then we'll be on 90-something.
Yeah, that's good. So are you not worried about running out of vaccines at all at some sites?
Well, currently, we do have sufficient sites and, I mean, sufficient doses of vaccines at our sites. However, there is a challenge that we started seeing yesterday, especially with the 18 to 34 cohorts, and it is one that revolves around the preference of a particular vaccine. But other than that, we think at least in the next 2 or so weeks, as far as our stock is concerned, we do have sufficient. And we know, of course, that there was recently a donation from the USA. So at the present moment, that is not of our concern. However, if it gets to a point where we ought to be worried, I'm sure National will be there to assist.
Yeah. Let's talk about preference when it comes to the vaccine. Are you seeing more people coming and saying that they want Johnson & Johnson or Pfizer? Is that an option, actually?
So as far as our SOPs are concerned, it's not an option. A person can choose to go to any site, and then you will receive what is offered at that particular site. So if anyone wants to exercise an option, then it depends on the site that they have chosen to be vaccinated at. But once a person is at a site, they cannot make that determination.
Yeah, it's very interesting because I've actually heard a couple of people saying they went to vaccination sites and asked for a specific jab. But just in terms of this younger generation, would Johnson & Johnson be something that you would consider giving to them, since you don't know whether they're actually going to come back for a second dose if they're given Pfizer? Is that a consideration for you at all?
Well, I have to be honest with you, not at this stage. Because if we look at, for instance, our province as Gauteng, we are more on the urban side compared to other provinces. So for us, of course, there's always a preference for Johnson & Johnson, especially when we are looking at mobile sites and add to rich areas, etc. But other than that, these vaccines, they are all equally good, and we have no reason to have a particular option or a preference, and all equally the same. We don't encourage people to make considerations between the vaccines that we offer.